Do you know the biological reason why we have pain? So pain is not something nice and we don't enjoy it. But there is a biological reason why we have pain. It is so that when you feel pain in a certain part of the body, it notifies your brain that that part of the body is exposed to a situation which causes injury, and injury could cause harm. And harm could cause destruction to that body part. So it signals so that if it's a limb, maybe a hand, you remove it from that injurious position. Or if it's an internal organ, maybe like your pancreas is inflamed or your gallbladder is inflamed, so that you may seek treatment. So pain is very good. It signals to your body that there is trouble going on, and your body either reflexively removes that part of the body from danger, or cognitively, now through thinking, tells you to go and seek help. So, does your body want to feel pain? As I said earlier, pain is not something nice and it's not something your body enjoys feeling. So, because your body does not want you to feel pain, so after you have felt the initial pain and you have already removed your limb from that injurious position, maybe it's on a jiko and it's burning, so you have removed it from the jiko, so it's no longer burning, your body does not want you to continue feeling pain forever because the purpose is done. So your brain manufactures some molecules called endogenous opioids, and these molecules are released after you have felt pain. So what are endogenous opioids? So we all know of synthetic or exogenous opioids that are used either as painkillers or as narcotics. But now these endogenous opioids are natural molecules that our bodies have devised to try to regulate pain. So your brain releases these molecules, three of them. One of them is called endorphin, another one is called enkephalin, and another one is called dynorphin. And these molecules travel from your brain and move throughout your body and bind to some receptors in your body called opioid receptors. And these receptors sit at the gate of pain signaling. So once the opioids bind to them, that is the endogenous opioids, then those gates of pain signaling close and your body no longer perceives the pain. Simple and clear. But as a bonus, besides closing the pain signaling, also the endogenous opioids causes a lot of pleasure. So you feel very happy. And that is why opioids are used as abuse drugs, because they make somebody feel very happy and very calm. So once you learn about this endogenous opioid system, then you will learn about three very key things that I want you to understand. One of the things I've already talked about is abuse drugs. And that is because of the pleasure that the endogenous opioids bring about. And you have to note that the opioids of abuse, that is the morphines, the pethidines, the fentanyls, so those ones, they are 100 to even 1,000 to even 1,000,000 times more powerful than your own body's natural endogenous opioids. So what that means is that if you use pethidine or morphine, then you feel 1,000,000 times nicer. It gives you the kind of pleasure that nothing else on earth can match. So that means that you become addicted to it. It glues you to it. That is how people become addicted to opioids. So the second thing that you need to understand about these exogenous opioids, such as the pethidines and the morphines, is that because they close the gate of pain signaling, then they are actually very powerful painkillers that are used either in surgery or in cancer treatment. So we only use them in severe pain. Yes, and if somebody is not under palliative care, we don't use it for a long time because it causes addiction. The third thing that understanding the endogenous opioid system makes us understand well is something we call placebo effect. So you have all heard of someone getting better by taking a drug that is not supposed to make them better. And these drugs are called placebos. So when you are given a placebo, so meaning a drug that has no active components, and you are told that it treats pain, then your body starts to feel that pain-killing effects, even though you have introduced nothing externally. As I said, placebos do not contain any active ingredient. When you anticipate a big change in your body and you are in a desperate situation such as feeling pain, then that anticipation causes your body to yearn for a solution. And if you are given a dummy solution, then your body believes that it's a real solution. And it does so by tricking you through releasing the endogenous opioids. So it releases these natural painkillers which calm the pain. So you think that the pain has been calmed by this drug that you have been given externally. And placebo effect is not just about dummy treatment. So sometimes, even when you're given real drugs, you get the placebo effect by starting to feel nice very soon after taking the drugs, even before the drugs are absorbed. Thank you.